Good afternoon. Welcome to the Lower Cape Fear's Talk on Health. This is a collaboration with the Lower Cape Fear YWCA and the Wilmington chapter of Delta Sigma Theta Incorporated. Good afternoon. Welcome to the Lower Cape Fear's Talk on Health. I will begin by making a land acknowledgement. The YWCA of Lower Cape Fear serves the people located within the Lower Cape Fear region. This land once thrived with life from indigenous peoples, known today as the Lower Cape Fear Indians and the Waccamaw-Siouan Indian people. Living in established settlements along the Cape Fear River and Lake Waccamaw, along with the many other established sites in the region. We need to protect and honor the history of these people. Indigenous peoples are not relics of the past. They are still here, and they are continuing to demonstrate their talents and gifts amidst a backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Thank you. I am Dr. Lekeshia Jarrett, and I'm a family medicine physician for Wilmington Health. Today's topic is very exciting. We're going to talk about living healthy starts with nutrition. Today, we will focus on nutrition and women's health in honor of International Women's Month. If we take a moment to review our past topics, COVID-19 was the first thing that we discussed. Obesity was a major risk factor for having severe illness with COVID-19. Then last month, we talked about cardiovascular health, and we discussed how a low sodium and a low fat diet are very important for maintaining good cardiovascular health, even at a young age. So this month, we're moving on to talking about nutrition. I feel like nutrition is a tie that binds all of our healthcare together. And as we move through the year and have these topics, this will come up again and again. These talks were created to reach a population of people who don't always have access to healthcare, or they can't ask as many questions as they would like of physicians. So we hope that we will answer the questions that they need. As we discuss this and we're trying to reach this particular population, I think that we also need to acknowledge that there are some barriers to getting a good nutrition for people in a lower socioeconomic status. The barrier I would like to highlight today are food deserts. Food deserts are geographic areas where there is not a grocery store within a long distance. These often happen in inner cities, and they also happen in rural areas. As I was reading about food deserts, I noticed that food deserts often have fast food restaurants. So people who can't get to fresh food, like fruits and vegetables, often learn to depend on fast food restaurants. I also found that there is a very high correlation in diabetes in people who have food insecurity or are located in food deserts. Thank you very much. Now I would like for my other panelists to introduce themselves, starting with Joanne. Thank you.
Thank you, Dr. Jarrett. I'm glad to be on this panel with such distinguished powerful women. So I'm glad to be here. I am Joanne Pierce, and I currently serve as General Manager for Health and Wellbeing for Durham County Government. And my portfolio includes overseeing public health, social services, cooperative extension, veteran services, and also overseeing the racial equity work across our enterprise. And so I'm glad to be here to participate in the presentation, and also as we have this conversation. And also, as you mentioned, Dr. Jarrett, maybe we can delve more deeply in those structural and systemic issues that affect nutrition and wellness for all people in our communities, and especially women. So thank you.
Next, we'll have Breyana. Breyana, could you please introduce yourself?
Yes, thank you, Dr. Jarrett. And I too am excited to join this panel this afternoon. Good afternoon, everyone. My name is Breyana Davis. I serve as the Food and Built Environments Extension Associate at North Carolina State University. And I lead and manage our Food and Built Environment program for our SNAP-Ed grant called Steps to Health. And I'm just excited to share more about how we're working to improve food security for our limited resource populations.
Thank you very much. And we have April MacAlpine on the phone, but she's unable to access her video right now. April, could you please introduce yourself?
Yes, ma'am. Thank you, Dr. Jarrett, for having me be on this panel. My name is April MacAlpine, and I am a board certified holistic health practitioner. And I have my own practice for minorities, and it's entitled General Nutrition Education Services for Minorities. I am currently a public health nutritionist with the New Hanover County Health Department. And, but I saw the need to express and stress my desire to teach minorities on how to be healthy, because I see that it's an issue. So for the last 12 years, I've been having my own practice as far as targeting minorities only in my practice. Thank you.
Thank you. So for our audience, if you have questions, please feel free to add questions to the chat. And we have some questions that we will begin with. Why do we need to talk about women's health and nutrition? April, would you like to answer that?
Yes, I'll take that question. Well, yeah, I think that we need to talk about women's health and nutrition, because in my experience, some women, not all, but a lot of women don't understand the impact that diet has on physical and mental health, especially if they're not experiencing any health problems. Younger women, I mean, I can relate to that myself. But because they're not experiencing any health problems, they don't think that their diet has anything to do with it. They're not aware that it could take anywhere from 2 to 20 years before a disease can manifest as a disease. And the majority of the people think that disease is only about genetics, so they're not worrying about their diet. But now we understand that genes load the gun, but your diet and environment pulls the trigger. So your genes are not your destiny. It's how you feed your genes and how they express is what can determine whether you will be diabetic or have high blood pressure or other chronic diseases. It's something called epigenetics. So that's why I think it's important, because like I said, in my field, I see this all the time, that people just don't know.
Thank you very much, April. Breyana or Joanne, would you all like to add to that?
Yeah, I definitely agree with what was stated. And I'd just like to add that women in particular are continuing to live longer. So the life expectancy is continuing to increase, which is great, but we have to be mindful of the choices that we make at a younger age, which have an impact on our overall quality of life. And I think it was also touched upon, just women are different from men. We have a different genetic and physical body composition makeup that differs from males. So just being mindful about how we process things differently, or how our body systems may function. And then also being mindful of the things that we choose to eat or may lack in our diet, and how that affects our risk for chronic disease. So whether that's vitamin deficiencies or at risk for other chronic illnesses, I definitely think that our choices influence not only our risk for poor health outcomes, but they affect our quality of life as we continue to age as well.
Thank you.
And only to add to what Breyana and April mentioned, perhaps from a structural or systemic point of view, two things: that there was a study by the Chan School of Public Health at Harvard that really asked the question, does our zip code, is our zip code a better predictor of our health outcomes than our genetic code? And that's really important. And I think Breyana mentioned also about built environment. So certainly it's important, that connection between nutrition and women's health, but also what's built around us to have the access to the health and wellness and nutrition. And Dr. Jarrett, you mentioned about, food deserts, the idea that in our modern society that there would be such a thing when we're rich in resources, but that certain communities don't even have access to grocery stores. And then we have to ask our questions that if it's not only in our various counties, but across our state and across our country, what is it about the systems and institutions that everywhere we go in certain environments that they would have a food desert? And so that's another conversation we would need to have. And then also, as many of you know, Dr. Frieden, the former CDC director from 2009 to 2017, when he served, he designed that pyramid, the 5-tier pyramid that talks about, where do we apply most of our intervention? Is it around the socioeconomic factors, or is it around the individual, work, clinical, that we all may tend to do clinical or counseling and education? And where do we get most of our value, our bang for our buck, in terms of addressing systemic and population health, as opposed to, or not even as opposed to, and we have to do the individual work as well. So it's a both and, as we are providing individual intervention, which we need, but then are we also addressing those systemic issues so that we will not continue to have people come to our systems and institutions at an unaffected rate because we haven't truly addressed the root cause issues of this very topic, which is very interesting that we're discussing today.
Thank you. I am going to add too that as a mother, when I eat healthy, my family eats healthy. So it definitely trickles down. I have 3 boys, and if I am preparing meals well and making sure that they have vegetable options and that they have, a lean meat on their plate or vegetarian option, then they are going to eat healthier. On the days that I'm lazy and I order pizza, of course, they are not eating as healthy. So, as it is often, women shop for groceries and they cook meals. So it is very important that we have a healthy diet also. The next question is, what are some examples of nutritional problems that are not discussed as often that you would like to highlight? Who would like to speak first? Either one of you.
I think the question is probably best for maybe April or Breyana in terms of the direct work that they do.
Sure. So I definitely think most priority, food insecurity, especially now during a pandemic where we were already suffering with high rates of food insecurity before, but now we have limited social distancing. People are not as active and they're not able to access the resources that they need, whether it's through a food pantry or other resources in their community. And I think it poses several problems. You mentioned this, Dr. Jarrett, talking about increased rates of obesity. So when families are living in food deserts, and I think now there's this shift to calling them food apartheids, because to your point, Joanne, we have this systemic issue of racism in our communities that are segregated based on years and years of just abuse and hate. And so that affects what's available to our communities. So when communities don't have access to a local grocery store or a supermarket where they can easily attain those items, they're left to choose, unhealthier items at their local convenience store. And that's a real problem. I think In my work, there is a lot of focus on nutrition education, but we also have to figure out how we can change and influence some of those policy systems and environmental initiatives to really make the healthy choice the easy choice. Because if someone has the education, that's great, but if they don't have access to that grocery store in their neighborhood, or they don't have a safe place in their neighborhood to be active, that's where the system is broken. So I would definitely say food insecurity is priority for sure.
Thank you, Breyana. I learned a new term, food apartheid. I haven't heard that before. Thank you. April, do you have anything to add?
I just want to second what she said. That's exactly what I was thinking.
And just to piggyback on what Breyana said about, just looking at systems and institutions, I'm reminded of an interaction I had, because I typically work with many different non-traditional partners in health. It may be judges, it may be CEOs of organizations, which we all know we work in public health, that we have some normal partners that we have, when people think of health, but we know that public health is about all of these things, the social determinants, where people are born, the conditions in which people are born, grow, work, and play, that all impacts our health. And I am reminded several years ago, I had a conversation with a regional, in a different state, a regional grocer who just oversaw a different region of, where grocery stores were planted, which levels of grocery stores, because we know that there are different types. It could be the same chain, but different offerings. So where they place the bistro and the bakery and the coffee shop within a grocery store, and where maybe, it's not at that level of grocery store. And that's, often by design, where they're going to get the most, as they believe, the most profit. And so one might imagine where those are being placed, where you have the larger one with more access to a variety of different foods and options. And one of the things, through a process of having conversation around race and racism and about systems and institutions and how we contribute significantly to racial inequities, that's a big, hard conversation to have. And, again, when you're talking about nutrition and, our fuel to move on and live and thrive, and that they make those decisions based on, obviously, their endpoint. But one of the important things that he said to me is that at one of the, I don't know, the larger tiered type of expanded grocery stores, sometimes when you look at fruits and vegetables and meats, that they would be at those grocery stores, but then, just before, and this is a true story, just before they would age or expire, because they wouldn't do that, they would send those to another grocery store. And so think of the power of what that impact is. And I had the same reaction to you, but it was at that moment in that conversation that person realized how that could impact what you bring to another grocery store, because how we shape the narrative, because they said was they looked at their data and how we interpret data. He said, oh, in that other zip code or other area, they don't really eat fruits and vegetables, and we see it expire and go out, so we don't replenish it. But could it be that what you're doing to bring those items over, and people making a decision not to take those items because it's almost about to expire? So just thinking about that, how systems play a huge role in nutrition and health and opportunities and access.
And once again, with my grocery store shopping, I know which grocery store to go to get the best grapes and the best oranges. Like, I have it down to a science. My husband talks about me, but I know which places to go to get the best produce. But I have access to transportation. So that's something else that you think about. We think about these areas that everyone doesn't have access to transportation to get to those stores. So they can't drive all over the place. So that was very eye-opening, Joanne. I had no idea about that.
And Dr. Jarrett, the fact that people already have in their mind that they have to go to another grocery store to get the fresher items, and how the system feeds into decisions that would cause that, and then how the data would bear what they believe that, oh, they don't use this here, so we won't put it there. But people are making decisions to go to another place because they aren't available as fresh, and the decisions that they're making. So how we have to do that both and, as you mentioned.
Right. Thank you.
And I just want to add, I think as we're talking about grocery stores, I think marketing definitely has a major influence on whether we make the healthy choice or not. I think for those that are moms can probably relate when you're shopping with your kids, they're grabbing the things that, attracts them. And so even working in that environment capacity to make sure that we are marketing healthier options, whether that's through nudges or shelf tags that highlight nutritional information. Some retailers have what's called a healthy checkout area where they've removed, because by the time you get to the checkout, you're like, oh, I need the gum, I need the candy, I need this. And so again, I love this type of stuff. If you want to research like behavioral economics, and you really have to change how things are placed in an environment in order to encourage that healthy choice. So this is definitely like a multi-level approach that will have to be broken down to see improvements.
The next question is, how does women's nutrition affect national economics? Any thoughts on that? Anything?
I think it really, again, goes back to how what we see in terms of access, opportunity, and if I'm not healthy, how well will I be able to work and gain a living? And it all again goes back to what is available to me, and the fact that what we're talking about is just not unique to our various locations or jurisdictions, but that this is a conversation that spans across our nation. And so of course it has an impact on our economy. And then it was mentioned already regarding COVID and the pandemic within the pandemic, which is about highlighting and seeing all of the racial and ethnic disparities and inequities that have always been there, but that have really shown themselves, and especially around food, our food system, nutrition, all of that. And that when people's basic needs are not being met. So certainly, and then our frontline workers being the ones who are potentially most exposed, and then are also the same folks who may have food insecurity. And so just all of it, how it plays into what we see today, and all of the strategies and conversations that we need to have to really directly address it, and not just for the immediate need, but how do we look at sustainability, and then how do we look at, really addressing these issues? And what we always know is that crises will always show what we probably have not been paying more close attention to.
I agree. Would anyone like to add anything to that topic?
Yeah, so I definitely agree with what you mentioned, Joanne. And I mean, thinking about people that are identified as in the lower socioeconomic class, they're already at risk of receiving poor healthcare services. So maybe they have chronic disease issues that are undiagnosed or not being managed. As you mentioned, talking about food insecurity that continues to rise. So if I'm a mom and I'm suffering with those issues, am I able to be productive at work? You're probably seeing increased rates of employee absenteeism, which contributes to decreased productivity at work. And this is a cycle that continues to just perpetuate itself. So, that has an impact on the family, the kids, the next generation, and, ultimately our continued high increased rates of poverty. So if we aren't able, again, to identify, what's allowing this system to continue to feed upon itself, we're not going to see any changes.
Thank you. My next question is, Can you name interventions used to address nutritional problems from adolescent women all the way to senior women? April, would you like to start talking about this?
Yes, I think basically the same concept for adolescent women and senior citizens, which is mainly a whole foods, plant-based diet. And of course, you know, in today's society, foods are not grown in the same soil. So we need vitamins and minerals, herbs and spices. But I think a lot has to do with how we are educated. And like I said, I can talk from a personal standpoint of even having a master's degree in nutrition, learning about carbs and calories and fat, but I was still fat. I was still over 200 pounds with a master's degree in nutrition. So once I started understanding and started going into holistic health, I understood that I had a visual of 8 ounces of juice having 10 teaspoons of sugar. When I visualized that, I had a wake-up call. So I'm educated on how much sugar is in there, and I give people visions now. And that makes a big difference than looking at calories and carbs. Just eat real food. I don't need a label on an apple. I don't need a label on broccoli. So, but when we get that message across, which is what I've been doing for the last 27 years, but focusing on the last 12 years, getting that message across, people are getting it. They're getting it and they understand it's real food. And you can eat. If you ate, try to go organic as much as possible. But you have to explain what organic is. If people don't have an understanding, they're not going to do it. Like I said, we didn't learn this in college. We just learned about like I said, the calories, the carbs, the fat. Fat don't make you fat. It's the bad fat that's the problem. But people don't understand what bad fat is or good fat is. Walnuts is good fat. Avocados is good fat. But when you just make a general statement, stay away from fat, count your carbs, count your fat grams, that's a problem. People can't do that forever. I've been on every diet in the world. But now I just eat real foods. And that's what I push on my clients and my students to just look at the foods, and I explain what processed foods are. Because in today's time, it's ultra processed. And that's my take on that.
What's the hardest part of your clients making the transition, April?
I think when they think they have a sugar problem, but I say, look, you can eat sugar, you just got to make sure it's raw and organic and still have it in moderation. See, the foods today are ultra processed.
Right.
And we need to eat foods as close to as God made it as possible. If they're going to eat potato chips, I know realistically people are going to eat potato chips, but get the ones that don't have all the other stuff on it, even though I'm not promoting it. But if you get potato chips, make sure they don't have all these other chemicals on it. Chocolate is actually good for you, but the sugar in that chocolate is the problem. I eat a piece of chocolate every night, but it's real cocoa with almonds in it. So I think the biggest problem is they hate giving up junk food, but I give them the alternative. Make sure it's healthy, well, a healthier version of the junk food. So that seemed like to be the hardest transition. And I always teach my clients, I say, some things you got to have the mindset to cut out certain foods, not cut back or not use it on special occasions. You got to have that mindset, because again, the chemicals on these foods accumulate in the tissues and create disease, which means dis-ease of the body down the road. So you got to get that mindset of getting rid of certain foods and still having stuff in moderation. I always tell people to switch immediately. Instead of eating processed rice, eat whole grain rice, but make sure grains are organic, definitely for sure, with all the glyphosate and all the chemicals on it. Switch sugar. Don't get the processed Dixie Crystal white, unrefined or refined processed sugar. Go to raw sugar. Okay, make your own lemonade. Use real lemons. Don't get the fake stuff with the pictures of fruit on it. And they start, and in my classes, I show them these pictures. And they get it. Because I make sure, I say, look, I say, see this thing of orange juice? It's pictures of oranges on it. But if you juice your oranges, it don't look anything like this. So that's pretty much how I deal with that.
Yeah, I was born, I'm a 70s baby. So, and I came of age in the 80s. And I think at that time, that's when everything was processed. It's just, even formula was, more popular at that time than breastfeeding. Just everything processed, easy. And that's how we learned to eat. So there is a lot to undo. One thing that I push with my patients is I just ask them to stop drinking sodas. Like, most of the time when people come to me to lose weight, the first thing I ask them to do is to stop drinking sodas. Unfortunately, some of them start drinking juice, and juice is like such a ruse. It has, like you said before, April, it has so much sugar in it, and people think it's good because it's fruit juice. So it's just education for the population too. Do you ladies have anything to add, Joanne or Breyana?
Yes, I appreciate what April shared, because that is, really important when we're providing education and support. I'm reminded, and many of you may know about this analogy, and you all are probably closer to water than I am. And so, many people find, being near bodies of water relaxing. And so do I. Or if you have an aquarium at your home and you're relaxing and watching, the fish you've purchased. But I'm reminded of an analogy that it says, when one or two fish go belly up in a lake, it really makes sense to look at, that happens, fish die. And so you're just looking at the fish and you're like, well, that happens. But when we're looking at that same lake, or you're looking at your aquarium and 1/2 or 3/4 of your fish are going belly up in the lake, what is it time to do? And sometimes people say, change the water. It might be easy in an aquarium to do that, but not so much in a larger body of water. But at least we should examine the water, even if we're not going to change it, to examine the water. And often that analogy is used to really be representative of our systems and institutions, right? That a lot of times, a lot of our work, and I mentioned that I oversee, areas of public health and social services. So it's a lot of people in it, or fish as you would have it. And so that we're paying a lot of attention, even when our data will show us that 1/2 or 3/4 of our fish or people are having, poor outcomes in our systems, but we're focusing a lot on the people or their behaviors, which is important because that definitely can impact our outcomes. But also, while we're doing that, we must examine the lake, how our systems and institutions, which is really challenging when we're working in our systems, but we have to become critical lovers of our systems and institutions to really be proud of the things that we do well, but then also critically examine the things that we may be contributing to for poor health outcomes, and that's looking in our policies and our practices and procedures, because that's where these inequities live, but we don't really necessarily see them. And so as we are working with individuals, and we've become quite proficient in the fish fixing business, but less proficient in looking at how our systems and institutions, or that water that we're generating. Because even if we addressed all of the fish in that lake, and there's going to be another group of fish that come up and have the same poor outcomes if we haven't done anything to address, how, the ways in which we operate would be impacting that. And then what ends up happening is that the people come to see Dr. Jarrett or April or Breyana at a point where there's so many other things that have occurred. And so you're unpeeling the onion and trying to give this instruction and education and support and clinical intervention. But often there's so many things that have happened regarding social, economic factors, their built environment, all of these things that often, people don't have control over, but within our systems, we do have control. And that's some of the things that we can do to help facilitate the work that you do, so that every single person who comes to you is not coming at in a crisis of needing that immediate intervention, clinical services. So it's both and I will never let my systems and institutions get a pass on that, because for generations we have set something up. Those of us here, we're living in a house that we did not build, but we do have to do the work to hopefully transform it.
Thank you. I have a question from the audience. Someone is asking if diet soda is okay, or if it's different than regular soda. And I think, April, you kind of touched on that a little bit. Could you expound on that some for me?
Diet soda is actually worse. Not only does it take calcium out of the bones, both of them have phosphoric acid. The artificial sugar is worse than the regular sugar. So artificial sugar has been linked to brain tumors. So definitely it's not recommended to have anything what's called considered sugar-free. So all those sugar-free drinks or Splenda or whatever, it's been so long since I've had that, I don't even know what you call it anymore. But to answer your question in the short, no.
No, thank you. Thank you, April. Okay, the next question that we have is, why do communities of color experience diet-related disparities? We've talked about this quite a bit, and consequently tend to have poor nutrient profiles and dietary behaviors and patterns relative to majority communities. I know Joanne has had a lot to share about that, and if you have anything to add, you can. Same for Breyana.
Yeah, I think we've covered this a bit, but it's really the system. I think for many people of color, they go and seek care, and it's not equitable. You know, they may have health issues that are being misdiagnosed or undiagnosed. And then they're living in communities that don't have the resources that they need, the basic resources that they need. And so this increases the risk for continued poor health outcomes. And so until we address some of these system and environmental structures, particularly that need changing, we're going to see, you know, continued increases of food insecurity and other chronic disease and even comorbidities that continue to affect and damage our health.
Can you or Joanne speak to any upcoming solutions or ideas that are being worked on to improve some of those community and systemic problems?
That's a really important question that you've asked. And often what I've seen is that the very folks mostly impacted have some great solutions, but often as systems and institutions, you know, we've gotten our degrees and learned the things that we believe we know. And then sometimes the community's voice is quite muted in, you know, different ways. So for instance, just an example, that when we're looking at the fact that many of our communities may have food banks, and that's great, I imagine, but the biggest issue when you think about health and well-being, think about what people donate to food banks. I mean,
canned
think
goods,
about it.
boxed foods.
I mean, when you think about that,
food, basically.
Yeah, and so they're you know, shelf-stable items and processed foods, and then often we pat ourselves on the back because, you know, we've had people donate, and then, you know, there are a lot of different things. I've walked through one recently, and I was just surprised. You know, there often you can look at, you know, the commodities that were created many years ago for our indigenous brothers and sisters. And so, and we think about all the things that were there, lard and flour and white sugar. I mean, just all of these things that's not the methods and ways in which you all would probably advise people to eat. But if people are trying to keep themselves alive and survive, you know, and they have to make those decisions. So that's a systems issue. Like, how do we address that? But, you know, and so one time there's a community conversation about, oh, we need a new food bank. And the community folks said, how about we get a grocery store? And the fact that that didn't come to anybody's thinking at that moment, that what would you prefer to have? You know, a food bank or a grocery store. And not saying that, you know, I'm not saying anything against food banks or, you know, but that, you know, we should look at even that and what recommendations do we have for food banks, you know, because they're part of our food system, you know, and so, you know, the fact that they went right to a true systems change of why don't you place a grocery store here? And so that's why we need even business communities and grocers in this conversation around nutrition and health, because where they place their business and what they place in their business and will impact people. And so that's one solution, like bring that there. And also around people's health, make it possible for people to, back to Frieden's 5-tiered approach, that he's like, put things where people, and I think Breyana mentioned it, change the context, put things where people can be. The default is something that's healthy, as opposed to people having to stick out their left arm to get a meal, that they can actually go and go to a grocery store. And where do we place all of these fast food restaurants or stores? Where do we place them? Which zip codes are just store after store after store is one of these types of stores where a grocery stores, or not even a grocery store, it may be even a mart, but where are we placing or where business is placing these items? And then the price point for some of these items, I'm not even going to go there, that you can get a whole lot of something for very little to feed people. And then, but that certainly is no excuse, because eating a healthful diet is within everybody's reach in terms of, because I hear that a lot too, that it's too expensive to eat healthy. And I disagree with that there are some ways that you can do that. And why do just opportunities to make it affordable for people though.
I will chime in on that, Joanne. I do think like fruit is extremely expensive. You know, I can pay $1 for an apple. So, and that's quite a bit of money. So I think as we approach systems too, like is there talk about making fresh food cheaper so that people do have more access to it. And you're right, you can find a way, but it's probably not an easy thing to do.
I would agree. And then often there's collaboration, and Breyana may know more about this with SNAP and benefits, that there can be prescriptions that physicians and other professionals, that they're called fruit and vegetable prescriptions. And I can send more information about that. And their collaborations with farmers markets and adding more funds, because you're right, Dr. Jarrett, I didn't mean to say that, but it's within people's reach, but then they have to make decisions about how far their money will go. Mm-hmm. But that there are veggie prescriptions and other types of prescriptions that clinical folks can write for folks who may be on supplemental food benefits, that they can get double bucks so that their money can travel farther along. So to compensate for the very thing that you've mentioned. So that's an equity approach that is making some traction.
That's a great approach. I like that plan.
Can I add something to that?
Yes, sure.
So I agree with you and Joanne. I was just thinking, because what I teach about, yes, an apple may cost more, but what I teach my students is that when you eat healthy, you eat less. So you're not as hungry. So when you're not as hungry, you don't spend as much money. And like I said, I'm speaking from a personal standpoint as well as an educational, because I see it all the time with my nutrition practice, how people are making that transition. Like I tell people, if you got 4 or 5 children and you're trying to eat healthy, if you gave each one of them an apple, they wouldn't be hungry for 4 hours, because of the fiber, the vitamins, and the minerals, and the nutrition in it. But if they had Apple Jacks, which is cheaper, they're going to be hungry in an hour or two. So real foods give you more satiety. You're not as hungry. It sends the signals to the brain to balance your brain and the chemicals in your brain, and it balances your blood sugar, so you're not as hungry when you eat real foods. That's why I tell people when they drink a lot of juice, they're constantly thirsty because that sugar is actually dehydrating. But water hydrates you, so you don't even drink as much when you drink water because the body is satisfied. So all this processed foods is causing people to think they need to eat all the time and they can't do this. And you know, you just gotta be really educated on the impact of real food versus processed foods, and then make a decision. I go in grocery stores just to look at food sometimes. And I look at people bent over, crippled, with a whole bunch of junk in their buggy. And I go over there, look at carrots. You can go in there today, go to Food Line today and look in there where they got a little organic section, I'm sorry, of organic carrots is about $1.49. But people don't understand the benefits of what carrots can do for the body. I'm just giving carrots as an example. The organic broccoli is not as, maybe 50 cents more than the regular broccoli. The bananas are not maybe 20 cents more. So, but people really got to be educated on the value of real foods and understand that you're going to save money in the long run. Either you're going to pay now or pay later with your health. And these prescription drugs that I'm sure you know, people are spending hundreds of dollars every month on prescription drugs, but they're buying cheap foods.
Or cigarettes.
Or cigarettes.
Yes. Yeah. Thank you very much, April. Good points. Breyana, you have anything to add to this topic?
Yes, I would like to just share of, some interventions that are happening now, because it's easy to focus on what we can improve, but there is some great work being done. So particularly in my role, I work with cooperative extension offices throughout North Carolina to make sure some of this change can happen in different communities. So we have select counties in rural North Carolina that are part of a healthy retail program. And they, as a part of that program, they're required to stock SNAP and WIC eligible items that people can then buy with their benefits, which is huge because, again, we want to make sure that they can have access to these healthy choices. We here in the Triangle, I work closely with the Central and Eastern North Carolina Food Bank, and they've launched, I think it's a couple of years now, their Healthy Pantry program. Again, trying to work with pantries to help them to become designated and making sure that they do have healthier options in stock, that they are creating a healthier environment for clients that frequent that location so they aren't receiving a lot of those processed foods, and then making sure that there are guidelines around healthy procurement as well. And I just want to add, as far as in the schools, that's where we see a lot of work being done. The USDA has their fresh fruit and vegetable program where eligible sites receive fruit and vegetables on a daily basis that then kids have access to. Because I think another layer is that if someone is considered or has the lower socioeconomic status, they may not even be familiar with certain fruits and vegetables in their whole form. I remember being in the community setting and I had kids that had never seen a whole pineapple, never seen a whole peach or a plum. And so programs that are able to even farm to school efforts. So whether it's farm to school, farm to early childcare, that have partnered with federal organizations and can receive funding to make sure that some of these systems and environmental approaches can be improved. So there's a lot of work that's being done, but there's definitely, opportunity for growth as well.
Good. I'm always excited when I see community gardens too. As I grew up in the country. So, every summer I was shelling peas and shucking corn and processing vegetables for my grandmother. So, and it really excites me, the idea of like growing your own food. So I hope that more people will get into that also.
And I'll just add, even now in the midst of the pandemic, that has the desire to reinvigorate some of these community gardens has continued to increase, which is exciting because, again, there's so many things that we're limited in doing with COVID-19 and the pandemic, but being able to not only have access to physical activity, but then to grow your own food, which is amazing. So yes, I'm excited as well.
We've spoken on a lot of these questions, but how can one economically improve their diet or improve their eating habits? Is there anything to add to that? You all have done so well covering everything.
I don't really have anything to add to that, but just to share that I believe from a structural or systemic level, one of the perhaps most challenging things we can do, or courageous things to do, is really turn the mirror inward and looking at our our policies and our practices, because if we use a root cause analysis, which really asks the question why and why again, at least 5 times, it'll lead us back to our system and our policies and practices and ways of being. And what I mean by that is, and it gives us a different question to answer, and it delve more deeply and get into the lake issues as opposed to, again, that whole fish fixing aspect, because we do have to help people. People are struggling, so people need clinical intervention, people need education, people need all of these things that our programs and services and work involves. But we also need to address how we may be unintentionally, due to our systems, setting up people to go in this way. Because even if we address all the people that we serve and work and we get them on the right path, there will be another group of people waiting for us to do the very same thing. And we have to get to the point where we can look at, our policies and our practices to see what are some of the rules that we have or guidelines, or what are we not creating. Dr. Jarrett, you mentioned, like transportation. I mean, there are so many other, and those are the non-traditional partners and that we need for health to increase and expand so that we can ensure people have better health outcomes. And so it's about parks and recreation. It's about, because public health, again, we all know this, that public health extends beyond healthcare services or extends beyond education. It's everything. But then we might be a little biased because we're in public health. But public health is everything, from transportation, all of it, where people can play and work and live. And so I think just looking at it at that point too, because often in our society, we assign benefits, or we assign the credit for people being healthy, and then assign the blame for people not faring as well, when we know there's a bigger context involved in that. And so, I think us delving more deeply as we do the work that is before us, and address the crises that are before us, but then really also examining our systems and institutions. And I've seen that. I've also, although I serve as the general manager for Durham County government, in my past work, I served as the executive director for the State Office of Minority Health and Health Disparities for the state of North Carolina, and also for the state of Texas. So, I've just seen when we do institutional transformation, we also address people we'll never be able to touch, who will never come into our offices, because we would have, provided an antidote or intervention that affected more people than we can touch or see.
When you said look inward, that made me think that I need to stop driving to different grocery stores and demand that the grocery store that I'm in provide better produce and better meat.
There you go, Dr. Jarrett.
Dr. Jarrett, I did that. I wrote a letter to the CEO of some people at Food Lion, and now I see it.
That's awesome.
I wrote a letter. I was serious.
And then you have helped all the people who frequent
Right.
that restaurant. So that's a systemic change for that grocery store.
Yeah.
Absolutely. Thank you. That was excellent.
Well, thank you for making us think about looking inward. Now we are gonna, well, April, I wanted you to talk about briefly, do you have any recommendations for older women, particularly in their nutrition, or any age-specific recommendations for women?
Same thing, whole foods, plant-based. When I say plant-based, it's not just being a vegetarian, it's just mainly plants. People can eat meats, but it's, you got to make sure they're, of course, if you can, grass-fed, no antibiotics, and very little. Because when you think about it, when you think back to our ancestors, we didn't eat. I think the problem with meat is we eat too much meat. If you think about the animals that we eat, let's say, it's not even realistic to catch fish, cows, turkeys in the same day. But we eating one for breakfast, one for lunch, and one for dinner. So I think the problem is we're eating too much meat and it's having an effect on us. And that's why everybody's saying, make sure you're vegetarian. But that's not necessarily the case for everybody. Sometimes it depends on your blood type, what better diet suits you. But overall, the general recommendation is making sure whole foods, meaning food in its original state, not processed, mostly plants, fruits, vegetables, nuts, and seeds, and just not leaving the processed stuff alone. So that goes for everybody. I'm getting a lot of success from the older people, my older women, of course, because they've done everything they thought they could do and they still suffer. So they're willing to make the change. And I bring it back to them. I say, you didn't grow up eating these potato chips. And they say, you're right. I said, why don't you make your own potato chips? Cut up different sweet potatoes. That's what I do now. I cut up sweet potatoes and put them in the oven and bake them. Or cut up white potatoes if you eat white potatoes. And things start recollect, they start remembering. They say, okay, you're right. We didn't eat this junk. And I'm like you, I grew up, well, I'm 53, but I grew up on in the country. I didn't grow up in the country, but my mother was. And I used to go in the country and snap those peas on the porch and crack walnuts, do everything. And I look back at my childhood now, I was like, wow, they was rich and didn't even know it. My grandmother didn't really get diabetes until she was in her 60s. Now I'm seeing 3-year-olds with diabetes. So it's the same thing. It's the same principle. It's a whole food, plant-based, unprocessed diet as much as possible, the best you can. I teach homeless people how to choose the right things. You may be homeless, you may not have the money, but when you go to the food bank and you see the bananas and you see the potato chips, get bananas. And
Thank you. That's good.
Yep. I'm sorry, what'd you say?
I just said thank you. That's profound. Just remember to stick with the whole foods and plant-based diet.
Exactly. Without a label, as much as possible.
So we only have 3 minutes. So I'm going to give each of you ladies 1 minute to leave your parting remarks. Breyana, will you start, please?
Yes. So as I shared, I think there's great things happening in North Carolina, around the world as well, but there's still work to be done. Like several have mentioned, maybe even focusing on multiple opportunities for exposure. We talk about how public health is everything from putting on your seatbelt to getting on your bicycle or just going to the grocery store to make sure you have access to the foods that you need. But we need to make sure that our kids, our churches, our senior centers, our parks and recreation, that there are multiple touch points for not only education, but opportunities to change those policy systems and environments to help make the healthy choice the easy choice.
Thank you very much. Joanne?
Yes, very quickly, I leave us with a challenge, a homework assignment. For those who may not know, look up the Pima Indians who were in the state of Arizona. And many years ago, obviously, they were hunters, fishers, farmers, had great health, 1 case of diabetes. And then, the dam was built to make way for Scottsdale. So when a dam is built, water is diverted. And so you may not be a fisher and a farmer or a hunter if water is diverted from your areas. And now they represent the highest case of diabetes. And so what did the government do? Provided commodities, as I mentioned, lard and flour and sugar and shelf-stable items. And so we could also ask ourselves, how are we participating and what are we doing that we're not seeing how we contribute to poor health outcomes? And so just look that up.
Thank you. April?
Eat real foods.
Thank you. I love that. It's very direct. You all have been wonderful today. I've really enjoyed talking to you and I've learned lots from you, and I hope that our audience has also. Thank you very much for joining us today.
Thank you. My pleasure. Appreciate it.
Thank you.
Thank you.